My message is knock it off. One of the biggest areas of spread is coming from that kind of private socializing. And by the way, you could shut down all the bars and restaurants, which the data doesn't support. You could do that, and some folks might irresponsibly just continue to have house parties and large private gatherings where we're seeing a lot of this spread coming from. And I would say to those folks, we get it. We're all sick and tired of this. We're impatient. I totally understand. Younger people especially want to get together with their friends. That's just natural. But I would just say, please don't be selfish, because we have a case. We went through. We were able to trace a number of deaths in a nursing home that ultimately came back to somebody's house party. So people's lives may depend on how you act in your own. You think your friends are not. Nobody amongst your friends, if you're younger especially, is going to be sick. Maybe I think that's what a lot of people imagine, but it's just not right. They may never be symptomatic, as most young people never are with COVID-19. But it can, as Dr. Hinshaw says, COVID-19 loves parties, and so please, if you're doing that, knock it off, because it might be your grandma, your grandfather, who ultimately gets infected in a nursing home. It might be your mom or dad who's been waiting for a year or two for surgery, who gets that delayed by months again because we have more COVID people going into the hospitals. So this is, I know people are tired of it. We're all fed up with this, but now more than ever, we need to take this seriously. And the single biggest thing people could do is just stop with the private parties and the social gatherings. Please respect the first 15-person rule. If we just did that alone, we would get this thing under control. I don't think that's too much to ask. And we could get it under control without putting more people out of work or putting even more pressure on the healthcare system.